I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. In North Carolina, there are currently 764 cases of COVID-19 in 61 counties. There have been 3 fatalities in North Carolina associated with COVID-19, and there is now evidence of community-wide spread in 31 of North Carolina's 100 counties. In the other 30 counties with positive cases, the cases are linked to travel or direct contact. On Wednesday, we announced the first individual to test positive for COVID-19 in Dare County. I am very pleased to share that this individual has recovered. We will continue to notify the public of any additional positive test results for COVID-19 in Dare County as soon as possible. We have received a number of questions and comments about testing and sharing results. I'd like to tell you a little bit more about the process. Medical providers in Dare County are following the North Carolina Department of Health and Human Services provider guidance for COVID-19 testing. This guidance states that if a patient is experiencing mild or moderate symptoms, which are manageable at home, the patient should be directed to remain at home and self-isolate. This guidance prevents patients from exposing others, including healthcare personnel, unnecessarily. The treatment for mild to moderate symptoms of COVID-19 is the same as the treatment for flu or other respiratory illnesses. Rest, drink plenty of fluids, and use over-the-counter medications as directed to help alleviate symptoms. If an individual is unsure about the severity of his or her symptoms or has specific questions, you are encouraged to call your healthcare provider or the urgent care provider to determine if a medical visit and testing is necessary. We communicate with our area providers on a daily basis, and I can assure you that Dare County providers continue to test patients who they deem appropriate and who also meet testing criteria, which includes fever of 100.4 or greater, cough, and symptoms of respiratory illness. Right now, it is taking anywhere from 3 to 8 days to receive test results back from the labs once specimens are submitted. We are sharing this information with you because we want you to know that testing is being done in Dare County. Once an individual is tested for COVID-19, that individual is immediately considered a person under investigation, or PUI, and required to stay at home and self-isolate until they receive a negative result. If the individual tests positive for COVID-19, he or she is required to continue to remain in the home under isolation until 72 hours have passed without symptoms of COVID-19. During the time the PUI is in isolation, our public health nurses remain in daily contact with the individual. During the daily check-in, the nurse asks about the individual's medical status and assesses the need for any support. This can include getting food or medications for the individual so the individual does not have to go out into the community. At the point an individual becomes a PUI, our public health team immediately determines any direct contacts. A direct contact means that an individual was within 6 feet or less of the PUI for 10 minutes or more. When we identify direct contacts, we notify those individuals so we can provide guidance and direction based on their exposure. It is important for all of us to do everything we can to help prevent the spread of COVID-19. We are all in this together. Earlier today, the control group issued a declaration for stay home, stay healthy. This includes additional restrictions being implemented to further minimize opportunities for exposure and transmission of COVID-19 in Dare County. As we move through this pandemic together, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center at 252-475-5008. Thank you.